Hi there and welcome. I know I have been talking about this for quite a few weeks about a new thing coming over to this channel. Well, it is finally here and welcome to the break room. This is the self-care safe space for nurses. And so thank you for coming by. So if you've been here with me following for some time, welcome back and thank you for the support. And if you're new here, welcome. And allow me to introduce myself. I am Deetra Dennis, and I am a registered nurse of 29 years. I am a national board certified health and wellness coach, and I am the self-care coach for nurses. Why am I the self-care coach for nurses? It is because I am devoted and I have a passion to support you as a nurse in prioritizing the care of your MVP. Who is the MVP? You are your most valuable patient. And so I want you to be able to care for yourself from the bedside to the table side. And so that is why I'm here as your self-care coach. And if you see me looking down, I have my notes because I can get off on a tangent and I want to, stay focused on what I want to share with you on today. And so, you know what? Did you know? And the reason why the break room is important, did you know that as nurses, we are less healthy than the average American? And this is a study that was done by the American Nurses Association. And the research showed that it was likely to nurses being overweight, high levels of stress, and less sleep. And so, again, we are the largest and most trusted healthcare profession. We have over 4 million of us, over 4 million nurses. And it is so important. Our health is critical to the health of the nation. And so this again is why the break room is created, so that you can have a respite, a place where you can go to for a short period of relief, um, and so that you can recharge and renew. So that is why I created the break room. And so the reason that came to mind, I remember when I first became a nurse, and as the rookie nurse in the hospital setting, you normally start off at night shift. So I was working 7P to 7A, and it's usually short staff, and you really rally together as a team and make it happen. You may have a lot going on, but you get through it together as the team. Together each achieve more, that acronym. So we stuck together, and whenever we had time to go to the break room, to escape, which wasn't often, and we need to normalize taking a break. I know that's another topic for another episode, but at any rate, whenever we had an opportunity to go to the break room, be it to eat our meal or eat a snack or just to escape from the floor, my colleagues then that are sister friends now, we're still connected. We would go into the break room to, chat it up, laugh it up. And again, I'm not a singer, but those two young ladies sang, okay? Not just a singer, they sang. And so, we would sing just whatever we could do to recharge so that we can go back to the floor ready to tackle whatever was, at hand. Another time is when I've had several positions or roles in nursing, which we'll get to throughout this series. But one of the other roles that I had was when I worked at a large health insurance company, and I worked in utilization management. Of course, you're in the office and you're sitting in cubicles. And so we, and those colleagues that are now sister friends, we are still connected to this day. And so we would scoot out to the end of each of our cubicles, and we would have what was called veranda time. And so that was when we would, take a break, and, we would catch up on, how are you doing? How's your family doing? You get caught up on all those things. But again, that was an escape, because even though, no, we were not on the floor direct patient care, but the caseload that we had with reviewing charts could be quite have a large volume of reviews, I would say, and it's time sensitive. So, we had that moment of escape. And other thing that rings true that I remember so well is that there were times, we would be busy, especially after a holiday or after the weekend. You have so many reviews because we did the inpatient or concurrent review. And so, like for me, whenever I was frustrated, I would just breathe, just long sighs all the time. And one of my other colleagues or sister friends, she would type real hard on the keyboard, and we knew, it's a rough day, or she has a lot going on. Or one of the other ladies, she would stand up a lot. So we knew, we felt each other, and if we had the opportunity and we had a slower day, we could help them out, again creating that sense of community. But the break room, I want that same experience where, like, we had the veranda time, or having that break room where we chatted up or just laughing it up to recharge so that we can go back and, tackle the task at hand. So that's what I want to create here on this series, The Break Room. And I hope that you will find it very valuable, the information that is shared, and so that you too can share this video with someone else. So while I'm on that, go ahead and like this video and subscribe to the channel. And as I mentioned before, share with someone else, a sister nurse or sister nurse friend, if you will, that could benefit from the information that I share. And also, as I would like to invite you to come over to my Facebook page, because I do have a live stream there, where I have the Monday huddle, and that is at 7 p.m. I just launched that. So if you would like to catch that, that is on Mondays at 7 p.m. And if you would like to subscribe to my newsletter, you can come over to the website at Full Circle Health Coaching LLC.com. So again, thank you so much for choosing this channel to come over and support and watch the replay. And you know what? Again, I want you to be able to say, when you have an opportunity to watch this video at whatever time that you will watch, it's your respite. And so you can tell all the others, or tell whatever, if you're working from home, it's your step away, or if you're in the car on your way home. Well, be safe with that, safe driving. But it's your opportunity for a short period of relief. And it's all love over here, no judgment over here at all. And, I appreciate you so much for being here and tuning in. So, I love my quote. The quote is still the same. So remember that you are the full circle, and within you is the power to create, nurture, and transform. So until next week, walk in your power.